Hi, my name is Choo Jiaen. The speaker mentioned in the speech that foster social courage is one of the methods to deal with social anxiety. I totally agree with this approach because facing fearful situations bravely is the first ways to overcome fear. To lead a fulfilling and regrets-free life, seizing opportunity and taking bold actions are imperative. Social interactions, being one of the most fundamental human activity, serve as a gateway to accessing various opportunity. However, as Chinese singer Mao Bu-yi mentioned in the variety show, you must let someone have a quiet yard. Everyone shows different personality traits and their life pace naturally diverse. We cannot force everyone to overcome social anxiety and become extrovert. What we can do is enable them to navigate simple social situations. Courage in social situations is indispensable, as highlighted by Blossom Medical Clinic, established in June 2018. When facing social anxiety, we can engage in internal self-affirmation, essentially a way of indirectly cheering and encouraging ourselves on. Another approach is cognitive behavioral therapy. We can call it CBT. It primarily involves challenging and changing strategy related to negative thought patterns in social situations, encouraging individuals to gradually face fear, represent a widely recognized therapeutic methods for treating social anxiety. I hope that everyone with social anxiety can muster the courage to overcome it. Perhaps with that first step, they will discover that it is not daunting as it seems. That's all. Thank you.
Hello, my name is Tiong Feng, and the problem I realized and understood from this video is about social anxiety. I agree with the method provided by the speaker in the speech. That is in the 10 and 33 seconds of the speech. She said we can identify social anxiety as soon as possible because more than half of the people will suffer from social anxiety before their 14th birthday. But how do we accurately mark social anxiety? We can ask them a few questions such as, is your fear of rejection one of your most fears, or does your fear of rejection prevent you from doing what you want to be or like to do? I agree with her speech because I think if we can find out the root cause of the disease early, we can fundamentally solve this problem. Of course, it is not to force them to become extroverts, but to at least not let social anxiety affect their daily life and routine. This can also enable them not to worry about these symptoms when they grow up or become irritable and do some irrational behaviors such as self-harm and extra. Not only that, I saw a study from the content of 21 News Health article that social anxiety usually begins in childhood or adolescence and is solved after adulthood. Among the individuals seeking treatment, the median age of onset is about 10 years old, and most of them have the disease before their 20s. However, a small number of people will suffer from this disease in the future. Therefore, this means that we must try our best to verify and discover whether our friends or family members have social anxiety disorders around us, so as to avoid this phenomenon appearing in their lives and affecting their future.
Hello, I am Aisyah, and the first solution that was given by the speaker was to identify the social anxiety in its early stages. I agree with her point, as it's easier to get treated if it's identified early. And to support my reasoning for saying that is that according to the National Institute of Mental Health about social anxiety, is that the first step towards effective treatment is to get a diagnosis from a mental health professional. After getting this diagnosis, the patient are able to get treatments to reduce their symptoms or even recover. Patients can reduce their social anxiety symptoms by getting into CBT or cognitive behavior therapy, or they can take medications such as antidepressant or anti-anxiety medications. Other methods that can be used to reduce symptoms or treat social anxiety is guided self-help, in which the patient will be using a workbook based on the cognitive behavioral therapy with therapist support. For my next point, once you identify the social anxiety early, you can get to know the cause of it, like whether it's hereditary, whether it's because of difference in brain structure, or because of the environment the patient grew up in.
In my point of view, I don't really think it's a good idea because it doesn't help on the root of the problem in social anxiety. As we know, the biggest social platform recently have like Facebook, Instagram, and Snapchat. Even though the social is complete at the platform, but it doesn't mean that can relieve social anxiety efficiently, because there's a difference between social platform and real life social. It is the face-to-face element. In social platform, the word is the only element in this social. Some of us don't even know how each person looks like. It will be dangerous for the people who have social anxiety because they can be scanned easily due to the lack of experience in social. Compared to real life social, facial language, body language, and vocal, this element is important when having social in life and is difficult to be trained in social platform. According to the article of BMC Psychology, the use of social media significantly impacts mental health. It can enhance connection, increase self-esteem, and improve a sense of belonging. But it can also lead to tremendous stress, pressure to compare oneself to others, and increased sadness and isolation. Mindful usage is essentially to social media consumption. The conclusion of my report is, of course, this solution may help you release some social energy, but it doesn't help to release social anxiety efficiently. That's all.